Welcome, everyone. We're so thrilled to be here with you today. We are presenting as part of the USC Autism Committee, and we're presenting on the experiences of young adults of color on the autism spectrum. We have some content that we'd like to cover, but we're also really interested in having this be interactive. So we would love to hear about your experiences. We've gathered sort of a lot of literature and some first-person perspective, but again, we really invite you to share your experiences, and we'd like for this to be reflective and discussion-based. So, my name is Linsey Grunes. I am an assistant professor at the USC Chan Division of Occupational Science and Occupational Therapy. And I am, I've been a clinician for about 12 years now, have worked with autistic individuals across the lifespan in a variety of different settings, including schools, outpatient clinic settings, community-based settings. And I also teach an undergraduate class in our occupational science minor that's focused on neurodiversity in general, but also on autism, and takes in large part is kind of organized around lived experience and first-person perspective. So welcome.
Thanks. Hi, and I'm Tracy Jalaba. I'm clinical faculty in our occupational therapy department, and I work in our occupational therapy faculty practice, where I work a lot with different, some of our different populations. So I work with a lot with our college students there doing lifestyle redesign services. And then I have a particular interest in our program for young adults on the autism spectrum. So I get to sort of work with a variety of people through that program. And then I'm also a member of our Disability Services and Programs office. And so work with students who are in need of various academic or housing accommodations through that office. Thank you. So we just kind of wanted to start with a brief overview of some important things to consider when we're thinking about adults with autism or adults on the autism spectrum. So most current estimates, I have updated this from a presentation, and it's grown by 1 million since I did the presentation in 2018. So just to give you a sense of that, but it's estimated that about 5.4 million American adults identify as being on the autism spectrum today. And that represents a large increase. As I said, those prevalence numbers, and Deborah is going to talk about those in a little bit, but those have been increasing for quite some time. We see with adults with autism that they tend to have poor outcomes related to employment, independent living, and life satisfaction. And that also they have a higher risk for several different physical and mental health conditions, and I'll talk about those on the next slide briefly, but that those risk factors we're really seeing increase with age. And the reason why we'll be talking about some of these things, comparing child services to adults, is that a lot of the services related to autism tend to be geared more towards pediatrics. And so we're seeing that as these individuals grow up into young adults and college students, which we'll be particularly focusing on today, that they're at risk for a lot of these different health concerns. And then that last quote at the bottom just talks about how much the number of individuals on the autism spectrum are enrolling in post-secondary academic institutions. So we've seen as this population grows, that these students are attending college at a higher rate, but that we're seeing that these students are struggling a lot more than maybe their typically developing peers, with things like higher rates of loneliness, anxiety, depression, and that we see that these individuals tend to drop out at a much greater rate than the rest of their peers. So a little bit about those enrollment numbers increasing. So we're seeing right now there's kind of a wide estimate from somewhere between 0.7 to 1.9% of all college students are autistic. And the reason for that gap is because a lot of students may enter college and may not need traditional accommodations. A lot of these students are very right, and do quite well academically. And so they might not register, for instance, with the Disability Services Office. And so there's some discrepancy about how many students really that we're seeing on our college campuses. And then we'll talk a little bit later too about some differences in diagnostic rates and things like that that could also be contributing to this number. So overall, of the population of sort of college age individuals on the autism spectrum, we're seeing that only about 32% end up going to college. And this is the second lowest rate for any group of disabilities. And then in terms of graduation rates, I mentioned briefly that we're seeing that students with autism are graduating at only about an average of 40% as compared to the national average of 60%. So these students are in need of more support, more individualized support when they get to college. And a little bit about some of the health trends that we see with adults on the autism spectrum. I mentioned those higher lifestyle risk factors. So we're seeing that these individuals are at high risk for many different types of chronic conditions, and that ranges from obesity to sleep disorders, gastrointestinal disorders, diabetes, high cholesterol. A lot of these things that we're really seeing are related to some of those lifestyle factors. And then these individuals are twice as likely to experience anxiety as their peers. And we see estimations for having co-occurring psychological disorders anywhere from 65 to 74%. And there's a little bullet there saying that those that participate in higher education may even be at a higher risk. And that's because some of what we know is that when we think of individuals on the spectrum, that those that are maybe functioning at a level where they are attending college and things like that, they may be more aware of some of the differences that they experience than their peers. And that can cause a lot of distress, anxiety, and depression. So we're seeing that our college students are maybe at even a higher risk here. And then we see that these individuals are tend to be at a decreased participation rate for these health promoting activities that are really going to help to mitigate some of these chronic health conditions. So things like physical activity, exercise, nutrition, stress management, and leisure participation. As we mentioned earlier, neurodiverse students often face challenges when they do enter the college environment. These are characterized prominently by feelings of anxiety, depression, and loneliness. And they may have difficulties managing their workload, engaging in good time management, managing sensory input with the different sort of environments that a college campus can bring, and then adjusting to those new social demands can be really challenging. And these challenges can further increase for neurodiverse students of color. So Joy Banks is a researcher at Howard University. And there's this great quote from her article. Again, would really recommend reading this one as well. But while greater access to post-secondary education has increased for many individuals with disabilities, the benefits of college degree completion remain unrealized for many African-American students with learning disabilities. So we're really seeing that while they may be entering college at a higher rate, the supports might not be there to really help them to be successful and complete those degrees. We also see that autistic Black and Hispanic children or individuals are less likely to have documentation than white children. And when we talk about documentation in a college setting, we're looking at paperwork that individuals may need to show to a disability services office in order to receive accommodations or services. So if anyone feels comfortable sharing in the chat, maybe any ideas you have of why some of these students may be less likely to have documentation, which is of course then going to limit their access to those academic accommodations that they might need. So any ideas that people have about why they may be less likely to have documentation? Yeah, it's great. Thank you, Dr. Bruner. So yeah, documentation often focuses on early childhood, right? So that's when we're seeing a lot of individuals might be diagnosed. So yeah, if they didn't receive that diagnosis as a child, they may not have that documentation. Great, and then seeing may not have access to consistent health services. Exactly. So if we see that there's that very fragile and sometimes negative relationship with the healthcare system, then that's going to impact their ability to work with clinicians to get that individualized documentation. Yeah, and then some of those behaviors that are maybe misinterpreted and then not receiving that diagnosis. We also see that in general, Black college students who have autism are less likely to label themselves as disabled, and they show often lower levels of self-efficacy than their white students. And again, this is really important in terms of being able to self-advocate, to get services, get connected to the places that they need to on campus in order to be successful. And then, yeah, some of the things that people mentioned already down here, that less access to diagnosis and support, and then that's creating that comparative disadvantage. Okay.
So where do we go from here? So I would like to present some food for thought, some ideas, some strategies, things to think about when we're thinking about supporting autistic students with intersectional identities. First is promoting autism and neurodiversity, which includes both strengths and some of the challenges that come with the autism diagnosis. Universities are really in a unique position to influence autism acceptance and thereby reducing stigma. Supporting students in identifying with their diagnosis, so creating safe spaces to do that. To the extent that autism is seen as a white male phenomenon, that means that women and minorities will continue to be underdiagnosed. So if colleges and universities highlight autistic diversity and reduce stigma, it's possible that more students who need the services will seek them out. Encouraging faculty and staff to sort of be out about their multiple identities. So faculty can bring intersectional scholarship into their courses. They can highlight people, the work of people from diverse groups. So the more that autistic folks and their perspectives, especially those with intersectional identities, the more those perspectives are amplified, the more acceptable autism becomes, which may then have the benefit of reducing some of the mental health issues that are associated. Sorry about the barking in the background. Also, so with the reflection piece, encouraging students to reflect on autism and identity. So in addition to identifying those reasonable accommodations, lawful accommodations, consider also broaching how cultural identity affects student experiences. So ask students, what is it like for you to be autistic and a Black man at this university? Or how does autism help you? And when these questions are asked sensitively, this can lead to a richer discussion about how to really best support that student, and can also make the student feel seen and heard in terms of all of their intersectional identities. For social opportunities and spaces, get input from students on the spectrum, especially making a special effort to seek input from females on the spectrum as well as minority groups. And wellness care. So as we've seen in the data previously in this presentation, anxiety and depression commonly co-occur with autism. And an intersectional perspective is valuable because it points to the cultural layers that affect the student's experience, as essentially being a part of two or more minorities simultaneously. So this slide focuses a little bit more on strategies to support autistic students, faculty, and staff of color, and also to some ideas of thinking about how do we engage in inclusive practices and anti-racism practices in the university context, and how does that relate to autism as well. So the first part I kind of spoke about already, but amplifying those voices, which means including these perspectives in research, on the instruction side, including these perspectives in your syllabus, your course content, your readings, even thinking about, are these perspectives highlighted or even visible in marketing materials for things like student organizations or different departments, department events. Challenging the systems and planting seeds of change. So what can be done in your environment to be more inclusive? How can you make your classroom more inclusive, your lab or your research team, your clinical environment? Continuously updating your knowledge and on matters related to autism and race, and working to acknowledge and address stereotypes you have about autism and race and those intersectional identities. We have resources, and really, again, highlighting the fact that updating your knowledge doesn't just mean looking at the peer-reviewed literature. It means looking at the first-person perspective as much as possible. Also bringing attention to racism, which means talking explicitly about this in trainings, in education for healthcare providers, DSP, educators, using your privilege for good, supporting mentoring pathways for BIPOC autistic adults. Consider using a collaborative teaching approach with a focus on civil rights and social justice, even regardless of what content you're teaching. This can be integrated. And I'll leave you with this thought, which I really appreciated from this particular article, which was a roundtable discussion from first-person perspectives. And that is, do what is right and not what is easy with regard to autism research, practice, and supports. So if you're a practitioner, maybe you can find ways to accept new types of payment, sliding scale fees. Maybe you need to hire additional staff who are multilingual, or offer non-traditional hours of operation, weekends, nights. If you're in research, maybe establishing quotas to ensure your studies include participants of color. It might mean it takes more time and effort, but it will be worth the effort. And it's important to consider advocating for more diverse data sets across all kinds of research. So a lot of resources listed here. I won't go through all of them. We made an effort to really highlight, again, first-person perspective here in the form of podcasts, memoirs, as well as other kinds of resources. So you can take a look at this at another time, or check in with us if you have questions about any of these.